10, Buffalo Bills safety Damar Hamlin remains in critical condition today after suffering cardiac arrest during the Monday Night Football matchup against the Cincinnati Bengals. The 24-year-old collapsed on the field after colliding with a Bengals receiver. With us now is Dr. Edward Howard, cardiologist with the Virginia Heart Medical Practice. So how is it that a 24-year-old professional athlete who is in such top physical condition, how is it that someone like that could have a cardiac arrest?
Well, that's a great question, and what an upsetting event this has been. What I can say is that this is something that when it occurs in a young athlete, that it is really a different set of circumstances to what we would typically worry about causing a sudden cardiac arrest. In a young adult, there are various conditions that can cause this. Some of them are congenital. Some of these things people can be born with that predispose them to such an event. And sometimes it can be a consequence of direct trauma to the chest itself, causing a condition called commotio cordis. These are things that are rather independent from the stuff that we would worry about typically causing heart disease, like cholesterol and high blood pressure and things.
And how does a cardiac arrest differ from a heart attack? Because often when people hear cardiac arrest, that's what they think of.
Well, that's also a great question. So sudden cardiac arrest occurs when the heart has an electrical storm that starts for various reasons, either trauma or some type of predisposing factor. A heart attack, what we would conventionally think of as a heart attack in the cardiac community, is when a sudden blockage occurs in one of the arteries that supply blood to the heart, typically either a clot or cholesterol. And that's exceedingly uncommon in patients, in young athletes. But there's a whole different set of conditions that can cause a sudden cardiac arrest independent of a heart attack. In other words, heart attacks can cause sudden cardiac arrests, but not all sudden cardiac arrests are caused by heart attacks.
And it's been reported that Hamlin received CPR on the field almost immediately after collapsing. How important was that?
I cannot stress enough the importance of prompt and early CPR in these situations. By far the most important predictor of survival in the situation of a sudden cardiac arrest is the quality and speed of CPR, and in particular the quality and speed of defibrillation. So the fact that this was recognized quickly and responded to promptly by both the players and the professionals on the field will give him the best possible chance of survival. And this is something that I think the viewers should hear. I think seeing the response of this unfortunate individual to CPR and prompt use of defibrillator, this is just the most important take-home message, I think, from this whole event.
We obviously don't know at this point how well he might have progressed. What are the chances of Hamlin or anyone resuming an athletic career if something like this happens? Is a full recovery possible here?
That's a tough question to answer. Certainly, there are people who have previously had a cardiac arrest while playing sports who've come back to play. Christian Eriksen, the Denmark soccer player, being the most recent example that we've seen. It really depends on a number of factors. It's definitely too soon to answer questions about that in this specific circumstance, but there are scenarios of people coming back to play. In terms of recovery, the prognosis depends a lot on the speed of CPR, the availability of the defibrillator, and the actions of those people around him. So I think from that perspective, I hope that he has the best possible chance of a good outcome.
Okay, Dr. Edward Howard, cardiologist with the Virginia Heart Medical Practice. Thanks so much.
Stay with us here on WTOP. We'll have more